Well, masks are now optional in many more locations, as Alicia was just saying. And more Michiganders are going out and socializing, visiting stores and businesses. That's part of the recovery we can see. What we can't see are the many ways many of us are still struggling with the ongoing mental and emotional recovery from the pandemic. And health leaders say we shouldn't expect the physical and emotional and mental health recoveries to line up, and that it's important to respect the healing process. The pandemic has been hard on all of us. For some, it's been devastating, worsening isolation and loneliness, creating anxiety, and for others, deepening depression.
It was like a jungle of wires in my head. It was making me sad, emotional, irritated, frustrated.
Detroiter Sharice Wilson says the pandemic has hit her hard emotionally and financially.
That right there, it's a lot of anxiety and stress all within itself.
Sharice says getting back on her feet has been a real challenge, and she expects the anxiety and stress of that to last long after the masks come off.
I'm at a point where I can't pay my bills again, back working, but it seems like you can't catch up.
From a mental health point of view, it's been a long 2 years.
Dr. Michelle Rebup is a professor of psychiatry at the University of Michigan. She says in addition to a rise in anxiety and depression during the pandemic, we also saw an increase of substance abuse, domestic violence, and child abuse. And those wounds will take even longer to heal.
There have been so many complex and complicated issues going on for many of us. All of us, actually.
Dr. Reba says the young, women, and people of color have been hit hard, and that the physical and emotional trauma and economic insecurity from the pandemic make it even harder to bounce back. In fact, that trauma could reemerge from lesser, more common triggers like stress at work or trouble making ends meet, and the symptoms often remain internal.
Trouble sleeping, and they would have fitful dreams and nightmares that would affect their mood and, concentration.
Or change in sleeping or eating habits, or isolation from friends. And when these symptoms return, we may not realize we're suffering from lingering emotional impacts of the pandemic.
It's really important to try to ask the question, what's going on?
Watch for signs of mental and emotional stress as we move forward, in ourselves and in those around us. Remember, it's okay not to be okay. Ask for help from your primary care doctor or pediatrician. Clergy are also a good source of support. Sharice says she's back in therapy and it's working. She says the key is to find a partner on the journey to mental health recovery.
It's really hard to find a good therapist. I have found a very good therapist.
And that is fantastic news, and we wish Sharice the best in her recovery. Now, Dr. Reba says to remember to be compassionate to yourself and to others, and don't expect any emotional or mental health challenges to just vanish. It takes work and it takes time, and everyone's recovery is individual. There's no set timeline for recovery. Dr. Reba is a member of the Eisenberg Family Depression Center at the University of Michigan, and they have some great resources if you or someone you know is struggling with mental or emotional issues tied to the pandemic. And even if they're not tied to the pandemic, they have some great resources for depression, anxiety, and many other issues.
Very helpful. It is okay to seek help. So many people focus on their physical health. They go to the gym, they have a trainer. You should have a trainer for your mind too if you need it.
And people think, well, the masks are over, so I should feel better right away. That's not the way these things work.
Wow. Thank you. Great story, Keenan.
Thank you.